Hepatitis A, a highly contagious liver infection caused by the hepatitis A virus. Some ways to contract hepatitis A are coming in contact with someone who has the virus, handling food that you eat when they haven't carefully washed their hands after using the toilet. You can also come in contact by drinking contaminated water, eating raw shellfish from water polluted with sewage, being in close contact with a person who's infected, whether they show signs or not, and having sex with someone who has the virus. Some signs and symptoms are fatigue, nausea and vomiting, abdominal pain or discomfort, especially near your liver, loss of appetite, low-grade fever, dark urine, muscle pain, and yellowing of the skin and eyes, also called jaundice. They typically don't appear until several weeks after the infection. Your body will get rid of hepatitis A on its own, but ways to cope with symptoms include resting when you need to, eating less amounts throughout the day rather than large meals to get rid of nausea, and to stop drinking alcohol and taking medicines that stress the liver. To prevent hepatitis A, a vaccine can be used and is recommended for people who are at higher risk of getting the infection. People should practice good hygiene, wash their hands often and thoroughly, and not share personal items like towels, utensils, or toothbrushes. When traveling to areas where outbreaks of hepatitis can occur, you can prevent infection further by peeling and washing all fruits and vegetables yourself, avoiding raw or undercooked meat and fish, drinking only bottled water, and using it to brush your teeth. And if you don't have bottled water, you can boil tap water. And also to ask for a beverage to be served without ice. Hepatitis is a non-fatal infection that will usually clear itself from the body. After it leaves, the previously infected person will normally become immune to the disease. 1 in 1,000 cases become fulminant hepatitis, which can be life-threatening. In very rare cases, the virus can cause liver failure, but usually only occurs in people who already have chronic liver disease prior to getting infected. Over 85% of people with hepatitis A recover within 3 months. Globally, there's an estimated 1.4 million cases of hepatitis A every year. Here you could see all the locations, mainly in Africa and India, and having intermediate around South America and Northern Africa in that area. History of hepatitis A. The virus was isolated by Purcell in 1973, and recent improvements in sanitation decreased the spread of hepatitis A. Between 1995 and 2006, the reported incidences declined by 90% to be the lowest rate ever recorded, 1.2 cases per 100,000 of the population. The hepatitis A vaccine was first introduced for children in communities with the highest rate of the disease in 1996. It was then introduced to children living in states and communities with consistently elevated rates of infection in 1999. Citations and history is right here. View.